I think that there has been a lot more attention by the providers on their patients who are maybe misusing the drugs, filling too frequently, filling before they should have run out, or maybe having symptoms of withdrawal. And then sitting down and having a frank discussion with their patients about opioid misuse disorder so that they're getting them into the proper treatment programs. And more of those treatment programs are available now. There are a lot of different treatments available. Some of the newer treatments and that are at least more accessible these days involve actually drug treatment that takes away the craving of the opioid. And so getting onto those types of drug-assisted programs to wean off of the narcotic or the opioid are really beneficial. And then of course there is the cognitive therapy that can go along with that. It does tell us that women in particular are probably a little bit more agreeable to go into treatment. Maybe the stigma now is gone. I think in the past a lot of people didn't want others to know that they had an addiction problem. But I think some of that stigma is gone. Everybody is talking about it, and you know, it is really interesting that it only takes 8 days, really, to become addicted to a narcotic. And so it's often not the patient's desire or fault that they become addicted to this medication. They're in pain, and before they know it, they have this need to fill that medication. And so they want to get off. They don't want to have this problem. I think that we should be very proud of ourselves in Nebraska, because for a state that didn't have a large opioid prescribing problem to begin with, we have decreased our opioid prescribing by almost 20%. And so I think the patients and the providers are all very aware, and they are following the CDC prescribing guidelines, and they're looking for alternate methods of controlling pain.